One leaf that lowers blood sugar, melts fat, and clears arteries fast. If blood sugar keeps rising no matter what you eat, if stubborn belly fat refuses to leave after 50, and if doctors keep warning about clogged arteries, this video is for you. There is one simple leaf, used quietly for generations, that many people over 50 completely overlook. It doesn't sound dramatic. It doesn't come in a fancy bottle. Yet research and doctors are stunned by how it helps lower blood sugar, melt fat, and support clean arteries, all at the same time, before adding another medicine or giving up hope. This is something every senior deserves to know. If you care about staying healthy, independent, and active after 50, take a moment now. Subscribe to this channel, like this video, and comment below where you're watching from. This helps us reach more seniors who truly need this life-saving information. Moringa leaf supports blood sugar control by helping the body respond to insulin more effectively as it ages. As people move past 50, cells often become less sensitive to insulin, causing sugar to remain in the bloodstream longer after meals. Compounds naturally found in moringa leaves, including isothiocyanates and chlorogenic acid, are known to support insulin activity and help glucose move from the blood into the cells where it is used for energy. This process helps reduce sudden spikes that can leave seniors feeling tired, thirsty, or unwell. Some doctors explain that moringa leaf may slow how quickly carbohydrates break down into sugar during digestion. This matters greatly for older adults because rapid sugar absorption can overwhelm an already weakened insulin response. When digestion slows slightly, blood sugar rises more gently instead of sharply. Studies have observed that people who regularly consume moringa, leaf powder, or extract often experience lower post-meal glucose levels compared to those who do not. This effect can be especially helpful for seniors managing prediabetes or early type 2 diabetes. Another reason moringa leaf is valued for blood sugar balance is its high fiber content. Fiber helps delay sugar absorption in the gut, which prevents dramatic highs and lows. For seniors, this stability is important because fluctuating blood sugar can affect mood, energy, vision, and concentration. Doctors often stress that steady glucose levels reduce strain on the pancreas, an organ that naturally becomes less efficient with age. Moringa leaf also provides antioxidants that protect insulin-producing cells from oxidative stress. Over time, high blood sugar damages these cells, making glucose control even harder. Research suggests that the antioxidant compounds in moringa help reduce inflammation linked to insulin resistance. Lower inflammation allows insulin to work more smoothly, supporting healthier sugar regulation without forcing the body into extreme periods. Moringa leaf helps address insulin resistance by supporting how cells respond to insulin as the body ages. After 50, muscle, liver, and fat cells often stop responding efficiently to insulin's signal, allowing glucose to remain in the bloodstream instead of entering cells for energy. Research shows that moringa contains bioactive compounds that encourage glucose transport into cells, helping insulin work as intended, rather than forcing the pancreas to produce more of it. Some doctors explain that insulin resistance is closely linked to chronic low-grade inflammation, which becomes more common with aging. Moringa leaf contains anti-inflammatory plant compounds that help calm this internal stress. When inflammation is reduced, insulin receptors on cells can respond more clearly, allowing sugar to move out of the blood and into tissues. This process helps prevent the cycle where high blood sugar leads to even greater resistance over time. Studies have also noted that moringa leaf supports healthier activity of enzymes involved in glucose metabolism. These enzymes help break down sugar inside the cell once it enters, which prevents glucose from building up in the bloodstream. For seniors, this means the body can use sugar as fuel more efficiently, instead of storing it or allowing it to damage blood vessels and nerves. Another important factor is moringa leaf's effect on fat tissue. Excess body fat, especially around the abdomen, releases chemicals that worsen insulin resistance. Research suggests moringa may help regulate how fat cells store and release energy, which reduces their negative impact on insulin function. This creates a healthier environment for glucose control without extreme. Over long periods of time, moringa leaf supports the reduction of stubborn belly fat by helping the aging body restore a healthier metabolic rhythm. After 50, metabolism naturally slows, and the body becomes more likely to store calories as fat, especially around the abdomen. Research suggests that compounds in moringa leaf help activate metabolic pathways that encourage the body to use stored fat for energy, rather than preserving it for long periods. Doctors often explain that chronic low-grade inflammation is one of the main reasons belly fat becomes resistant to change with age. Inflamed fat tissue sends stress signals throughout the body that interfere with normal fat-burning processes. Moringa leaf contains anti-inflammatory plant compounds that help calm this internal inflammation. When inflammation is reduced, fat cells become less defensive and more willing to release stored energy. Another way Moringa leaf supports fat reduction is through its effect on blood sugar stability. Frequent blood sugar spikes signal the body to store fat, particularly in the abdominal area. Studies show that Moringa helps keep glucose levels steadier, which reduces the hormonal signals that promote fat storage. For seniors, this can mean less accumulation of new belly fat over time. Moringa leaf is also associated with improved function of enzymes involved in fat metabolism. These enzymes help break down fatty acids so they can be used as fuel. As people age, enzyme activity often weakens, slowing fat burning. Research indicates that Moringa's natural compounds may support these enzymes, helping the body process fat more efficiently instead of allowing it to linger. Belly fat is not just a cosmetic issue for people over 50. Doctors warn that excess abdominal fat is closely linked to heart disease, insulin resistance, and inflammation throughout the body. By supporting metabolism and reducing inflammatory stress, Moringa leaf helps address the deeper causes of fat buildup rather than masking the problem. This gentle metabolic support is why some healthcare professionals discuss Moringa leaf as a natural aid for seniors struggling with stubborn belly fat that no longer responds easily to the body changes during aging years safely overall. Leaf supports liver fat reduction by helping the aging liver process and release stored fat more efficiently. After 50, the liver often becomes slower at handling fats and sugars, which can lead to fatty buildup inside liver cells. Research suggests that compounds in Moringa leaf support enzymes involved in fat metabolism, allowing the liver to break down fat instead of storing it. Doctors often explain that a fatty liver interferes with blood sugar control and overall metabolism. When excess fat accumulates in the liver, insulin signaling weakens, and sugar remains in the bloodstream longer. Studies have shown that Moringa leaf may help reduce this fat accumulation, improving how the liver responds to insulin and regulates glucose levels. This support is especially important for seniors, as liver efficiency naturally declines with age. Moringa leaf is also known for its antioxidant properties, which help protect liver cells from oxidative stress. Over time, high sugar levels and excess fat damage liver tissue, slowing detoxification pathways. Research indicates that antioxidants in Moringa help reduce this cellular stress, allowing liver cells to repair and function more effectively. A healthier liver can process fats and toxins without becoming overloaded. Inflammation is another key factor in liver fat buildup. Chronic inflammation encourages fat storage inside the liver and disrupts normal metabolic signaling. Moringa leaf contains plant compounds that help calm inflammatory responses, which may reduce the signals that promote fat accumulation. Doctors note that lowering liver inflammation is a critical step in reversing fatty liver changes in older adults. Balance Moringa leaf supports artery health by helping reduce the buildup of plaque that slowly narrows blood vessels with age. After 50, cholesterol balance often shifts, allowing more low-density lipoprotein to circulate in the blood. Doctors explain that when this cholesterol becomes oxidized, it sticks to artery walls and forms plaque. Research shows that Moringa leaf contains plant compounds that help reduce cholesterol oxidation, lowering the chance of plaque forming in the first place. Healthy arteries depend not only on cholesterol levels, but also on flexibility. As people age, arteries tend to stiffen, making it harder for blood to flow smoothly. Studies suggest that antioxidants in Moringa leaf help protect the inner lining of blood vessels from oxidative damage. When this lining stays healthier, arteries can expand and contract more easily, which supports steady blood pressure and proper circulation. Some doctors note that oxidative stress is one of the most overlooked contributors to artery blockage in seniors. Oxidative stress damages blood vessels and accelerates plaque growth, even when cholesterol levels appear only moderately high. Moringa leaf is rich in antioxidants such as quercetin and chlorogenic acid, which help neutralize free radicals before they harm artery walls. This protective effect can slow the progression of artery narrowing over time. Inflammation also plays a central role in clogged arteries. Chronic inflammation signals the body to send immune cells to blood vessel walls, where they contribute to plaque development. Research indicates that Moringa leaf has anti-inflammatory properties that may reduce these signals. Lower inflammation creates a calmer environment inside the arteries, making plaque less likely to grow or harden. For adults over 50, maintaining clear arteries is essential for heart health, brain function, and physical stamina. Doctors often stress that improving circulation supports oxygen delivery to every organ. Moringa leaf helps by addressing multiple factors at once, including cholesterol balance, oxidative stress, and inflammation. This broad support helps keep blood moving freely, rather than forcing the body to compensate for narrowing over time. Moringa leaf helps reduce bad cholesterol by supporting healthier fat processing in the aging body. After 50, levels of low-density lipoprotein, often called LDL, tend to rise as metabolism slows and liver efficiency declines. Doctors explained that excess LDL circulates longer in the blood and is more likely to attach to artery walls. Research shows that moringa leaf contains natural compounds that help limit how much LDL is produced and released into the bloodstream. Studies have observed that moringa leaf may also support an increase in high-density lipid, known as HDL. HDL is considered protective because it helps carry excess cholesterol away from the arteries and back to the liver for removal. For seniors, this balance between lowering LDL, supporting HDL is important because it reduces overall strain on the heart without forcing sudden changes in cholesterol levels. One way moringa leaf influences cholesterol is through its antioxidant content. Oxidized LDL is far more damaging to blood vessels than regular LDL. Some doctors warn that oxidative stress increases significantly with age, accelerating cholesterol-related damage. Antioxidants found in moringa help protect LDL from oxidation, making it less harmful even before levels begin to decline. Moringa leaf may also affect how cholesterol is absorbed in the digestive system. Research suggests that certain plant compounds in moringa bind to cholesterol in the gut, helping reduce how much enters the bloodstream. This gentle reduction supports healthier cholesterol numbers over time, rather than abrupt drops that may concern older adults. For people over 50, managing LDL cholesterol is about protecting long-term cardiovascular health. Elevated LDL is linked to heart disease, reduced circulation, and increased risk of stroke. Doctors often emphasize gradual improvement through sustainable methods. Moringa leaf supports this approach by working with the body's natural systems instead of to maintain healthy cholesterol. The best time to take moringa leaf for blood sugar and fat loss is when it can work in harmony with digestion and hormone cycles, which change as people age. After 50, the body processes food more slowly, and insulin response is often weaker. Some doctors explain that taking moringa leaf before or during meals helps slow the absorption of sugar, reducing post-meal spikes and supporting steady energy levels throughout the day. Research indicates that timing can influence how effectively the body uses the leaf's compounds for glucose. Controlled moringa leaf taken in the morning or before breakfast is often recommended for seniors because it aligns with natural circadian rhythms. During this time, insulin sensitivity is usually higher, and the body can more efficiently use nutrients for energy rather than storing them as fat. Studies suggest that moringa's plant compounds help stabilize glucose and support early metabolic activity, which may enhance the body's ability to burn stored fat throughout the day. Some doctors also note that taking moringa too late in the evening may interfere with digestion and sleep patterns, as the leaf's natural compounds are active in supporting metabolism. Proper timing ensures that the stomach and liver are not stressed and that blood sugar levels remain balanced overnight. Research has shown that gradual, consistent use at strategic times improves both fat metabolism and glucose regulation without blood sugar and weight management. The correct dosage of moringa leaf is essential for seniors to gain its benefits safely. After 50, the digestive system becomes more sensitive, and the body processes nutrients differently than in younger years. Doctors often emphasize that taking too much moringa can lead to digestive discomfort, including bloating or mild cramping, and in some cases may cause blood sugar to drop too quickly. Research indicates that a moderate, measured dose provides support for blood sugar regulation and fat metabolism without placing unnecessary stress on the body. Studies suggest that daily doses of moringa leaf, powder, or standardized extracts should be adjusted for age, body weight, and overall health. For seniors, smaller doses taken consistently tend to be more effective than larger, irregular amounts. This approach allows the body to gradually incorporate the leaf's beneficial compounds into metabolic and digestive processes. Some doctors warn that exceeding recommended amounts may overwhelm the liver and kidneys, particularly if other medications are being taken for blood sugar, blood pressure, or cholesterol. Proper dosage also ensures a balanced effect on glucose levels. Rapid reductions in blood sugar can be risky for older adults, leading to dizziness or weakness. Research shows that steady, controlled intake of moringa leaf helps stabilize post-meal glucose without sharp swings. Additionally, moderate doses support fat metabolism and cholesterol balance while minimizing the risk of side effects, which is especially certain seniors should be cautious when using moringa leaf because it can interact with medications and underlying health conditions. People taking blood pressure medication may experience an additive effect, which could lower blood pressure too much. Doctors often warn that this can lead to dizziness, fainting, or falls, particularly in older adults whose cardiovascular systems are more sensitive. Research has shown that moringa's natural compounds can influence circulation and vessel relaxation, which is beneficial in moderate doses, but may become risky when combined with prescription drugs. Seniors who manage diabetes with medication should also be careful. Moringa leaf naturally supports blood sugar regulation, but combining it with insulin or oral glucose-lowering drugs can occasionally lead to sudden drops in blood sugar. Studies indicate that severe hypoglycemia can be dangerous in older adults, affecting brain function, balance, and energy levels. Doctors emphasize that careful monitoring is essential if moringa is used alongside standard diabetes treatments, and dosage adjustments may be necessary under medical supervision. People on blood-thinning medications may face additional risks. Moringa has mild anticoagulant properties, which can enhance the effects of these drugs and increase the risk of bruising or bleeding. Research notes that even small changes in clotting ability can be significant for seniors, especially those with a history of heart or vascular issues. Medical guidance often recommends avoiding moringa entirely in these cases or using it only under close supervision. Use. One of the most common mistakes seniors make when using moringa leaf is choosing the wrong form. Moringa is available as fresh leaves, dried powder, capsules, or teas, and each form delivers its compounds differently. Doctors note that some seniors assume all forms are equally effective, but research shows that powdered leaves or standardized extracts often provide more consistent levels of bioactive compounds. Using forms with lower potency can reduce benefits for blood sugar control, fat metabolism, and artery health. Another frequent error is incorrect dosage. Some seniors take too much, thinking a higher amount will speed results, while others take too little and see no noticeable effect. Studies indicate that excessive intake can lead to digestive discomfort or unexpectedly low blood sugar, particularly in older adults who are more sensitive to metabolic changes. Conversely, doses that are too low may not support insulin sensitivity, cholesterol balance, or fat-burning pathways effectively. Doctors emphasize that following recommended dosages ensures maximum benefit without unwanted side effects. Mixing moringa leaf with certain foods or supplements is another oversight that can interfere with its effectiveness. Some compounds in dairy, very high-fat meals, or certain medications can reduce absorption of moringa's antioxidants and plant nutrients. Research shows that pairing moringa with these foods may blunt its impact on blood sugar regulation and inflammation reduction. This interaction is often overlooked, so seniors may unknowingly limit the leaf's potential despite using it consistently. Timing and consistency are additional factors that affect results. Irregular use or taking moringa at suboptimal times of day can lessen its impact on metabolism and glucose control. Doctors highlight that seniors benefit most when moringa is taken consistently and aligned with digestion and natural hormone rhythms. These mistakes are often subtle and can go unnoticed until energy fluctuations, bloating, or blood wellness. Doctors are surprised by the effects of moringa leaf because it supports multiple aspects of health that usually require several medications in seniors. Research shows that its natural compounds help stabilize blood sugar, allowing the body to manage glucose more efficiently even as insulin response weakens with age. This effect reduces post-meal spikes and helps maintain steady energy, a benefit that typically requires careful medication management in adults over 50. Studies indicate that moringa's influence on insulin sensitivity works gently, providing consistent support without forcing sudden changes in metabolism. Moringa leaf also aids fat reduction, particularly around the abdomen, where fat tends to accumulate after 50. Doctors note that this is a region often resistant to traditional exercise and diet alone. The leaf's anti-inflammatory properties and support for metabolism help the body use stored fat for energy instead of holding onto it. Research highlights that these effects occur gradually, which aligns with the needs of aging systems, allowing fat reduction without stressing cardiovascular or reduction in older adults. The combination of these effects is why doctors are particularly impressed. A single natural leaf provides a multi-targeted approach to common age-related health challenges. For seniors over 50, this means fewer spikes in blood sugar, gradual fat reduction, and healthier arteries, all without the complexity of multiple medications. Medical experts emphasize that such a holistic effect from a single plant is rare and noteworthy, making Moringa leaf a valuable addition to natural strategies for long-term metabolic and cardiovascular support. Its ability to work gently yet effectively across several systems explains why healthcare professionals often highlight it as a remarkable tool for aging wellness. Thank you for spending these few minutes here. Growing older does not mean giving up strength or comfort. With the right foods and small daily choices, the body can continue to support you well. This channel is here to share simple, research-based guidance that helps people over 50 stay steady, active, and confident. Take care of yourself, listen to your body, and join us again for the next video.